Hello, and thank you for joining us for the next in our series of honest conversations about safety, which is the theme of this year's Patient Safety Congress. My name is Mike Mallion, and I'm the director of the Congress at HSJ. I'm delighted to be joined today by Dr. Habib Naqvi, MBE, who is the Chief Executive of the NHS Race and Health Observatory, who is also joining us as a speaker at the Congress. Habib, thank you for joining us today.
Great, thank you for having me, Mike.
First off, I wanted to ask you, given the multiple challenges that the NHS has faced over the past few years and continues to see, can you share what you see as the most pressing ethnic inequalities challenges at present, particularly when viewing through a patient safety lens?
Well, Mike, I'm the Chief Executive Officer of the NHS Race and Health Observatory, and the work that I do isn't just about race. It's about patient safety and it's about saving lives. We see inequalities in healthcare access and in experience and outcomes across a range of different conditions. And these disparities are set against higher prevalence rates for many conditions that we are all too familiar with: specific cancers, cardiovascular disease, diabetes, mental health, maternal and neonatal outcomes, and the list goes on. And of course, what we've seen over the last 3 years is the disproportionate impact of a pandemic upon our most vulnerable and ethnic minority communities and healthcare staff. We know that there are biases in our policies and our processes. We know that there are biases in our medical devices and in assessments. The work that we have done on some of these areas has tried to focus on debiasing our healthcare system. So just as an example, the very first piece of work that we did when we were established was to focus on racial bias in pulse oximetry. And that was during the heart of a pandemic that was affecting people's oxygen levels in their bodies. And yet we knew that the darker the color of your skin, the less accurate the pulse oximeters are likely to be. And that further evidence was needed, yes, but guidance needed to be looked at with immediate effect.
Great, thank you very much. And can you tell me about any other work that you're currently focusing on at the NHS Race and Health Observatory to tackle sort of bias and ethnic inequalities and safety and champion the voice of ethnic minorities?
Yes, sure. This year we published a report looking at neonatal testing, the APGAR score, which came out in 1952, judges the health of a newborn soon after birth, partially on the color of the skin of the newborn. That was not right in 1952, certainly not right today in 2023. So there's a level of urgency for us to focus on disparities. There's a level of urgency for us to focus on the bias that leads to patient safety challenges, that then leads to poorer experience and outcomes for our diverse communities. And it's not just maternal health. We're focusing on mental health. We're looking at the sickle cell care pathway and a range of areas that we really do need to focus on in order to have equity in healthcare.
Thank you. And one of the kind of main focuses that we have at Congress this year is on giving voice to patients and families and allowing them to be able to affect change within the NHS. And obviously this is a sort of a larger challenge within ethnic minority patients and families. What do you sort of see as the main barriers preventing the ethnic minority patients and families voicing their concerns, and what do you what can be done to overcome this sort of now and in the longer run?
Well, we need to create an environment and a healthcare system where the most vulnerable in our society are able to voice their concerns, and not just voice their concerns, but be heard. And what we do within the NHS Race and Health Observatory is do exactly that. We have patient and community voices at the heart of what we do. Just recently, we published a report looking at access to healthcare for people with a learning disability from an ethnic minority background. And that co-design, that co-production with people with lived experience was at the heart of what we did, right from the outset all the way through to the actual launch of the report.
Thank you. That's really, really good to hear. So you're also a speaker at this year's Congress, and your session is focusing on how are health inequities and discrimination impacting patients, families, and how can this be fixed? Can you share a little bit more about what you're planning to focus on in this session, and what you also want to get out of it?
So it's about what people can do. It's about what people can take away from these kinds of sessions. And we know, as we've highlighted before, there's a level of urgency for us to focus on this agenda because it's about saving people's lives. And so, in a way, our country, our healthcare system, should be well placed to deal with that level of urgency. We have a long history of migration in this country. We have fairly robust legal frameworks in the Equality Act and the Health and Equalities Duties, and we've always had very good research in healthcare. But at the same time, it can also be argued that our collective responses to tackling the biases that lead to patient safety challenges have been somewhat confused and costly, and where specific organizations have been looking at these issues from a surface level perspective. What we need to do is look at the causes of the inequalities that we see. And that means, yes, looking at some of the biases that are inherent in our policies, in our procedures, in our medical devices, and in the assessments that are carried out on a day-to-day basis across the whole of the healthcare system.
Yeah, absolutely. And I guess obviously, there are, I think, 120 speakers and around 1,000 attendees in total. I'm most excited to see and hear about from this September's event.
The first step to any change is to acknowledge that there's an issue to tackle. It'd be great if people can think about where these biases exist in their day-to-day work, and to do something about those, kind of tackle those biases head on. And of course, we also know of that relationship between engaged and supported staff and better outcomes for our patients, and highlighting that relationship, making sure that, yes, we focus on patients and we focus on patient outcomes, but that organizations also focus on treating their staff well because of that well-evidenced link between happy staff and safer and better outcomes for our patients.
Thank you very much for your insights today, and I look forward to hearing more on tackling ethnic inequalities and safety at the HSJ Patient Safety Congress on the 18th and 19th of September. So, as a reminder, you can still book your place to attend, and we hope to see you there. Thank you very much, Habib.